for offering me this opportunity. Friends, Rajasthan, the jewel in the crown of India, is famous for so many things. When I was a student, I learned that Rajasthan is famous for its desert, but it has offered the most fertile ground for trying and testing out innovations under Norway-India Partnership Initiative. The key mandate of Norway-India Partnership is that it provides catalytic and strategic support for trying out innovations in the area of newborn and child health, and it is for the state governments and the national governments to decide in a span of 3 to 4 years whether to scale them up or do away with them. And I'm proud to say that 100% of our innovations under phase 2, that is 5 of them, have been accepted for scale up countrywide. And let me congratulate the Rajasthan government and especially its very dynamic mission director, Shri Naveen ji, for taking up one of our innovations which will be launched statewide, family-centric care, on 2nd of October by the respectable health minister. Its other innovations, home-based newborn care, through which we are trying to modify the global policy of home visitation from newborn care, expanding its ambit to infant care. We work in 13 districts of 4 states. In the 3 districts of Rajasthan, Alwar, Bharatpur and Dausa, so far 200,000 visits have been conducted, and the results have been so much encouraging that country has accepted to scale it up in all low birth weight children across the country, and with an additional mandate for which Rajasthan is putting up its proposal to the national government of expanding it under innovation heads in new districts wherever it is feasible. The major part which I'll be talking with you today is family-centric care. Since morning we have been listening about women's empowerment and family-centric care. We did an assessment of the facilities together with the national government, and the 2 major challenges emerged. We offer solution based on what problems we come across. One of the problems which came across was that mothers, poor mothers, they were lying outside the hospitals. 10% of the cases, the country's data showed, die even after discharge from highly sophisticated newborn units, for which Rajasthan government itself has spent more than 300 crores of rupees in establishing in each of the districts. And the result was that it wasn't making much of a change in terms of mortality, because the women were not getting empowered in bringing about newborn rearing practices. So we started this innovation known as family-centric care, where mothers are counseled, their capacity is built, even when the child is hospitalized, so that after discharge, they can become a spokesperson, not only in providing quality care to their own small and sick newborn, but also as a spokesperson, a role which is traditionally taken by mother-in-law and other people in the society to the other women. The third thing which we find out small solution is that I was talking with, again, kind courtesy of Shri Naveen ji, with the in charges of newborn care unit, and they are collecting huge amount of data because they have launched e-solutions, and based on that, but the data is not being utilized for quality improvement. We developed first time globally a set of 7 or 8 indicators, analyzed that data with a color coding. You can see at our Nipi stall with the result that state can prioritize where the visitation has to happen. And what are the areas? Is it that there is a problem in the delivery room, or is it a problem with the cross infection, or is there a problem with the supportive care, so that the highly trained supportive supervision, which can be provided only by select few, they can go and have a focused look on that particular area. The third innovation, which I'll just give you a glimpse, is that in our assessment, one of the weakest link we found was a 4th delay in the facilities. When the patient is referred from the facility, because for all your community program, to get a sanctity, unless prompt management is done in the facility, and we found with an assessment that there was a delay of around 30 minutes time before the treatment is provided to that patient. And imagine the plight of a young infant, a small baby who comes to you convulsing, and I have seen fights and riots breaking out in different parts of the country, and including a report from AIMS which came a week back. So we started this novel concept of emergency triage and treatment with the help of nurses. One of the places where we demonstrated was Alwa. Encouraged by its success, Government of India requested us that you develop operational guidelines for improving the quality of the pediatric care in all district hospitals, and those guidelines have now been released by the national government, with the result that each of the district hospital is entitled to spend 20 lakh rupees from the NHM funds to kickstart this innovation. So I'll not be coming in the way of your lunchtime, but I'll say that yes, Norway-India partnership has been offering a lot of solutions to small problems, and Rajasthan government have not only been taking them to scale, but even showcasing in the last year's Call to Action Summit, which happened in Delhi when Prime Minister Ji inaugurated that summit. Rajasthan showcased 3 of its innovation to the global fraternity, and I'll again congratulate the Rajasthan government. Thank you. I hope I've stuck to your time.
Sir, thank you. Sir, please be on stage. Thank you very much, and we apologize for you to make it quick. Thank you so much. I request MD NHM Shri Naveen Jain to please present a memento to our guest from Delhi, Shri Dr. Harish Kumar, Project Director of Norway-India Partnership Initiative. A round of applause for Dr. Harish Kumar. And here we break for lunch.